At this very moment, thousands of retirees across the U.S. are missing out on an extra $2,400 simply because they're unaware of a crucial Social Security filing deadline that's just around the corner. If you're already receiving benefits or planning to apply soon, what I'm about to reveal could determine whether you claim every dollar you deserve or leave money on the table. The Social Security Administration has specific enrollment periods and filing windows that most people completely overlook. Missing these deadlines doesn't just delay your benefits. It can actually cost you thousands of dollars in payments you'll never get back. November 10th is one of those make or break dates that the SSA doesn't advertise widely. And by the time most retirees find out about it, it's already too late. In just a few minutes, I'll guide you through exactly what paperwork needs to be submitted, who's eligible for this extra payment, and the straightforward steps you must take before November 10th to ensure you receive your full Social Security benefits. This isn't a trick or a loophole. It's about claiming the benefits you've rightfully earned after years of hard work. Let me tell you something that most people don't realize about Social Security. The system is incredibly complex, and the Social Security Administration isn't going to call you up and remind you about every deadline or opportunity to maximize your benefits. They process millions of claims every year. And while they're doing their best, it's ultimately your responsibility to know when to file, what to file, and how to make sure you're getting every single dollar you've earned. That's why this November 10th deadline that is so critical, and why missing it could mean saying goodbye to $2,400 that should be in your pocket. Now, before we dive into the specifics, I want to make sure you understand exactly what we're talking about here. This isn't some government handout or special program that only a few people qualify for. This is about understanding how Social Security benefits work in conjunction with Medicare enrollment periods and how the timing of certain decisions can have a massive impact on your overall financial picture. The $2,400 figure I mentioned isn't just a random number. It's based on real calculations that affect real people every single year, and I'm going to break down exactly where this money comes from and why you need to act before November 10th. Let's start with the basics of how Social Security and Medicare work together, because this is where a lot of people get confused. When you turn 65, you become eligible for Medicare, and there's something called the initial enrollment period that lasts for 7 months. 3 months before your birthday month, your birthday month itself, and 3 months after. During this time, you need to enroll in Medicare Part B, which covers doctor visits and outpatient services. Here's where things get tricky and why the November 10th deadline is so important. If you don't enroll in Medicare Part B during your initial enrollment period and you don't already have other creditable coverage, like insurance through a current employer, you'll face late enrollment penalties that last for the entire time you have Medicare Part B. That means a 10% penalty for every 12-month period you were eligible but didn't sign up. And it gets added to your monthly premium for life. But that's not the whole story. There's also the general enrollment period, which runs every year from January 1st through March 31st. If you missed your initial enrollment window, you can sign up during this period, but your coverage won't begin until July 1st. That means not only will you face penalties, but you could also go months without coverage, potentially racking up medical expenses that Medicare would have otherwise covered. This is where that $2,400 figure starts to make sense. When you calculate the penalties over a year, plus the out-of-pocket costs you might incur without coverage, plus the potential loss of certain benefits, it adds up fast. Now, November 10th specifically is important because it falls within the Medicare Advantage open enrollment period, which runs from October 15th through December 7th every year. During this time, you can make changes to your Medicare coverage, switch from original Medicare to Medicare Advantage, switch from one Medicare Advantage plan to another, or drop your Medicare Advantage plan and return to original Medicare. But here's what most people don't know. The decisions you make during this period can directly affect your Social Security benefits because your Medicare premiums are typically deducted directly from your Social Security check. If you choose a plan with high premiums, you're going to see less money in your monthly Social Security payment. If you choose a plan that doesn't cover what you need, you could end up paying thousands out of pocket for medical care. Let me break this down in practical terms. Suppose you're receiving $2,000 a month in Social Security benefits. The standard Medicare Part B premium for 2024 is roughly $174.70 per month, which is automatically deducted from your Social Security check. That means, from the start, you're left with about $1,825. Now, if you missed your initial enrollment period and you're facing a 10% penalty, that's an additional $17.47 per month, bringing you down further. Over the course of a year, that penalty alone costs you hundreds of dollars. But if you also chose a Medicare Advantage plan with additional premiums, or if you need to pay for prescription drug coverage that you didn't sign up for during the right period, those costs keep adding up. Before you know it, you're looking at $200 or $300 or even $400 less per month than you should be getting. And over a year, that's thousands of dollars. The reason I'm emphasizing November 10th is because it's right in the middle of this critical enrollment period, and it gives you enough time to make informed decisions and get your paperwork processed before the December 7th deadline. A lot of people wait until the last minute and then they run into problems with their applications, or they realize they don't have all the information they need, or they make rushed decisions that aren't in their best interest. By focusing on November 10th as your personal deadline, you give yourself almost a month of buffer time to handle any issues that come up. Now let's cover another critical factor: the Income-Related Monthly Adjustment Amount, or IRMAA. This often catches people off guard because it directly affects your Social Security benefits. IRMAA is an extra charge added to your Medicare Part B and Part D premiums if your income exceeds certain thresholds for 2024. For singles with a modified adjusted gross income over $13,000, or married couples filing jointly with income over $26,000, your Medicare costs will be higher. Depending on your income, these surcharges can range from an additional $69.90 per month up to $419.30 per month for Part B alone. Here's how this ties into that $2,400 figure and why timing is so crucial. The Social Security Administration calculates your IRMAA based on your tax return from 2 years prior. So in 2024, they're using your 2022 tax return. If you had a one-time spike in income that year, maybe from selling a home, taking a large retirement account distribution, or another financial event, you could be hit with IRMAA surcharges, even if your current income doesn't warrant them. The good news is that you can appeal your IRMAA determination if you've had a life-changing event like retirement, marriage, divorce, death of a spouse, loss of income, producing property, or loss of pension income. But you have to file this appeal within 60 days of receiving your IRMAA determination letter, and you need to provide documentation to support your case. If you're currently paying IRMAA surcharges and you qualify for a reduction based on a life-changing event, successfully appealing could save you hundreds of dollars per month. Over a year, we're talking about potentially $2,400 or more back in your pocket. But if you miss the deadline to appeal, you're stuck paying those higher premiums until the next year when the Social Security Administration reassesses your situation based on more recent tax returns. This is another reason why that November 10th date is so important. It gives you time to review your Medicare costs, determine if you're paying IRMAA, figure out if you qualify for an appeal, and get that paperwork submitted before you lose your chance. Another important factor is how Social Security claiming strategies interact with your Medicare decisions. Many people don't realize that when you apply for Social Security can directly impact your Medicare coverage, and vice versa. If you're still working past age 65 and have employer-based health insurance, you may be able to delay enrolling in Medicare Part B without facing penalties, as long as your employer has 20 or more employees and you're covered under their group plan. This can be a smart strategy, letting you avoid paying Medicare premiums while you're still employed and protected by another plan. But when you do eventually retire and lose that employer coverage, you have a special enrollment period to sign up for Medicare Part B without penalty. and that period is only 8 months long from the time your employment ends or your group health coverage ends, whichever comes first. Missing that 8-month window is where people get into serious trouble. If you think you have employer coverage, but it turns out it doesn't count as creditable coverage, or if you misunderstand when your special enrollment period starts, you could end up facing those late enrollment penalties and being forced to wait until the next general enrollment period to sign up, which means going without coverage for months. I've talked to people who missed their window by just a few days and ended up paying penalties for years because of that small mistake. And when you're living on a fixed Social Security income, every dollar matters. Let's also cover the Extra Help program, officially called the Low-Income Subsidy, which helps people with limited income and resources pay for Medicare prescription drug coverage. If you qualify, you could save over $5,000 a year on prescription costs. And the application process is surprisingly straightforward. The problem is, many people who are eligible don't even know this program exists, or they assume they won't qualify and never apply. The income limits are higher than most expect, and even if you don't qualify for full extra help, partial assistance may still be available. But you have to apply. And if you do it during this open enrollment period, you can have that assistance in place for the coming year. That's real money saved on prescriptions, leaving more of your Social Security check for other essential expenses. Another critical piece of this puzzle is understanding how Social Security's earnings test works. If you're claiming benefits before your full retirement age and still working for 2024, if you're under your full retirement age for the entire year, Social Security will deduct $1 from your benefits for every $2 you earn above $22,320. If you reach your full retirement age during 2024, Social Security will deduct $1 from your benefits for every $3 you earn above $59,520 until the month you reach full retirement age. These earnings limits can significantly reduce your monthly Social Security check. And when you combine that with Medicare premiums and potentially IRMAA surcharges, you might be getting far less than you expected. Understanding these rules and planning accordingly before November 10th can help you make better decisions about when to claim benefits, whether to keep working, and how to structure your income to maximize what you receive. I also want to address something that confuses a lot of people: the difference between Social Security's full retirement age and Medicare's eligibility age. You become eligible for Medicare at 65, but your full retirement age for Social Security depends on when you were born. If you were born between 1943 and 1954, your full retirement age is 66. If you were born in 1955, it's 66 and 2 months. It goes up gradually until, if you were born in 1960 or later, your full retirement age is 67. You can claim Social Security as early as 62, but your benefits will be permanently reduced if you claim before your full retirement age. On the flip side, if you delay claiming past your full retirement age, your benefits increase by about 8% per year until you reach age 70. These decisions about when to claim Social Security are separate from your Medicare enrollment decisions, but they interact in important ways that affect your overall financial picture. The bottom line is this: November 10th isn't just an arbitrary deadline meant to create urgency. It's a strategic target that gives you enough time to review all your options during Medicare's open enrollment period, gather any necessary documentation, consult experts if needed, and make informed decisions that could impact your finances for years. Whether it's avoiding penalties and potentially saving $2,400, appealing IRMAA surcharges, optimizing your Medicare coverage, applying for extra help, or simply making sure you're enrolled in the right programs at the right time, acting before November 10th gives you the breathing room to do it right. Don't be the person who waits until December 6th only to discover you're missing crucial documents, or worse, misses the deadline entirely and has to live with the consequences for a year or more. Your Social Security benefits are money you've earned through decades of hard work, and you deserve to claim every penny you're entitled to, without unnecessary penalties or fees eating away at your check month after month.